Singaporeans have been asked to give their ideas on shaping the country's new healthcare strategy, Healthier SG. Now, this aims to improve health across the population, with residents enrolling in with a family physician as their first line of care throughout their lifetime. And the public consultation will run from May to August ahead of the scheme's rollout next year. And Sherlyn Sia has more.
For 40-year-old Lily, seeing the doctor has become a family affair.
My whole house, like my husband, my kids, and my helper come and see him. He understands about our illness and our history of the illness that we had before, because we explained to him. So he have the record, so we don't have to repeat whatever we had before. And then whenever we tell him, he already knows what our medicine actually suitable with us.
That's exactly the goal of the upcoming Healthier SG strategy, that Singaporeans have a clinic they visit regularly for all care needs. Everyone gets their individual health plan and undergoes regular screenings to keep well. And the public's now asked to give their input so that the scheme can roll out smoothly. Interested Singaporeans can attend one of 5 in-person engagement sessions or participate in an online survey.
We want to find out, why do residents not go to one doctor? Because that's really what we wish everyone would do. Because then the doctor will understand you, understand your medical history. Number 2, if you stick to a doctor and the doctor give you a care plan to help you stay healthy, what are the things that you wish to see in that care plan? And what are the things that we can do to encourage you to stay with the care plan and don't give up?
Mr. Ong adds that the ministry's already begun engaging general practitioners for feedback on what support may be needed for them to upkeep and improve operations. Some ideas that came up were fairer drug subsidies, better IT systems, and also tighter partnerships between public and private healthcare.
A private-run clinic will never be able to achieve the sort of depth of care that we want to do for patients, and certainly we can't do without our colleagues in the specialist hospitals or the public hospitals. And I think what will bring the collaboration even further is the amount of communication we have with the public sector together with us in terms of how do we then continue to follow up on their care and decant their care to the community.
Moving forward, the Health Ministry will continue engaging more doctors and healthcare professionals, even insurers, to hear their feedback and concerns on Healthier SG before tabling a white paper in Parliament for debate later this year.
An assurance to the public as well. The Health Minister says new Omicron subvariants BA.4 and BA.5 have not been linked to greater severity. He said their presence is not a surprise and is expected, given that COVID-19 will continue to mutate.
More importantly is, so far there has been no evidence that BA.4 and 5 will cause more severe illness. Neither is there evidence to show that if you are previously infected with BA.1 and 2 and you have been vaccinated with all the common vaccines that we use, you continue to have very strong resistance against severe illness against BA.4 and 5. So that is the most important, because that is fundamentally how we live with the virus, is to protect ourselves against falling severely ill should we get infected.